Question 1. A nurse is caring for a post-operative patient who suddenly develops an elevated heart rate, decreased blood pressure, and cold, clammy skin. What should the nurse suspect? A. Infection. B. Hypovolemic shock. C. Myocardial infarction. D. Pulmonary embolism. Answer: B. Hypovolemic shock. Rationale: the symptoms of tachycardia, hypotension, and cold, clammy skin suggest hypovolemic shock, possibly due to blood loss. Question 2. A nurse is caring for a patient who has been diagnosed with acute kidney injury, AKI. The patient's urine output is 30 milliliters over the last 4 hours. What is the nurse's priority action? A. Increase the IV fluid rate. B. Administer diuretics as prescribed. C. Notify the physician immediately. D. Assess for signs of fluid overload. Answer: C. Notify the physician immediately. Rationale: decreased urine output in AKI may indicate worsening kidney function or fluid retention, requiring immediate physician intervention. Question 3. A nurse is caring for a patient with a history of alcohol abuse who is experiencing withdrawal symptoms. The patient becomes agitated, disoriented, and begins to hallucinate. What is the nurse's priority action? A. Administer lorazepam as prescribed. B. Administer antipsychotics as prescribed. C. Increase the oxygen flow rate. D. Provide a calm environment and reassure the patient. Answer: A. Administer lorazepam as prescribed. Rationale: lorazepam is used to treat alcohol withdrawal symptoms, including agitation and hallucinations, and to prevent seizures. Question 4. A nurse is caring for a patient who has just undergone a total hip replacement. The patient reports sudden onset of chest pain and difficulty breathing. What is the nurse's first priority? A. Administer oxygen therapy. B. Call for immediate medical assistance. C. Perform an ECG to assess for MI. D. Assess for signs of a pulmonary embolism. Answer: D. Assess for signs of a pulmonary embolism. Rationale: chest pain and difficulty breathing after hip replacement surgery suggest a possible pulmonary embolism, a serious post-operative complication. Question 5. A nurse is caring for a patient who is receiving IV fluids for dehydration. The nurse notices a sudden increase in the patient's respiratory rate and the presence of crackles in the lungs. What is the nurse's immediate priority? A. Increase the fluid rate to improve perfusion. B. Decrease the IV fluid rate and notify the physician. C. Administer diuretics as prescribed. D. Administer oxygen therapy to improve oxygenation. Answer: B. Decrease the IV fluid rate and notify the physician. Rationale: crackles and increased respiratory rate suggest fluid overload, which requires the immediate reduction of IV fluids to prevent further complications. Question 6. A nurse is caring for a patient with suspected stroke. The patient is exhibiting slurred speech and right-sided weakness. What is the nurse's first priority action? A. Call for a stroke code and prepare for thrombolytic therapy. B. Perform a neurological assessment and monitor vital signs. C. Administer aspirin as prescribed to prevent further clot formation. D. Prepare for a CT scan to confirm the diagnosis. Answer: A. Call for a stroke code and prepare for thrombolytic therapy. Rationale: a suspected stroke requires rapid intervention, including calling a stroke code and preparing for thrombolytic therapy within the recommended time window. Question 7. A nurse is caring for a patient who has just undergone an open-heart surgery. The patient develops a fever and signs of infection at the surgical site. What is the nurse's first priority? A. Administer antibiotics as prescribed. B. Assess the patient's vital signs for signs of sepsis. C. Notify the surgeon immediately. D. Prepare the patient for a chest X-ray. Answer. B. Assess the patient's vital signs for signs of sepsis. Rationale. Infection after open-heart surgery requires immediate assessment of vital signs and close monitoring for systemic infection, including sepsis. Question 8. A nurse is caring for a patient with acute pancreatitis. The patient suddenly becomes hypotensive, tachycardic, and diaphoretic. What is the nurse's priority intervention? A. Administer IV fluids and monitor vital signs. B. Prepare the patient for surgery to drain the pancreas. C. Administer pain medications as prescribed. D. Start broad-spectrum antibiotics. Answer. A. Administer IV fluids and monitor vital signs. Rationale. The priority in acute pancreatitis with signs of shock is fluid resuscitation to prevent organ failure and restore hemodynamic stability. Question 9. A nurse is caring for a patient receiving IV heparin therapy for a deep vein thrombosis DVT. The patient's APTT is 100 seconds normal, 30 to 40 seconds. What should the nurse do first? A. Increase the heparin infusion rate. B. Administer protamine sulfate. C. Notify the physician immediately. D. Decrease the heparin infusion rate. Answer. D. Decrease the heparin infusion rate. Rationale. An APTT of 100 seconds indicates the patient is at risk for bleeding, so the heparin rate should be reduced to bring the APTT within the therapeutic range. Question 10. A nurse is caring for a patient post-lumbar puncture who complains of a severe headache. What is the most likely cause of the headache? A. Infection from a puncture. B. Post-lumbar puncture headache from CSF leak. C. Increase in intracranial pressure. D. Migraine headache. Answer. B. Post-lumbar puncture headache from CSF leak. Rationale. A post-lumbar puncture headache is commonly caused by a cerebrospinal fluid CSF leak, which occurs when the puncture site does not seal properly. Question 11. A nurse is caring for a patient with acute respiratory distress syndrome ARDS, who is on mechanical ventilation. The nurse notices that the patient's oxygen saturation has decreased to 85%. What is the nurse's first priority action? A. Increase the PEEP settings on the ventilator. B. Administer a sedative to calm the patient. C. Suction the airway to remove secretions. D. Increase the oxygen concentration to 100%. Answer. C. Suction the airway to remove secretions. Rationale. A decrease in oxygen saturation and possible airway obstruction may indicate secretions that need to be cleared by suctioning. Question 12. A nurse is caring for a patient with severe hypokalemia. The patient exhibits muscle weakness and irregular heart rhythms. What is the nurse's first priority action? A. Administer potassium supplements as prescribed. B. Administer an antiarrhythmic drug. C. Assess the patient's ECG for changes. D. Increase the patient's oral intake of potassium-rich foods. Answer. A. Administer potassium supplements as prescribed. Rationale. Potassium supplementation is necessary to correct hypokalemia and prevent life-threatening arrhythmias. Question 13. A nurse is caring for a patient with suspected sepsis. The patient is febrile, tachycardic, and hypotensive. What is the nurse's priority action? A. Start IV antibiotics as prescribed. B. Administer antipyretics to reduce the fever. C. Initiate fluid resuscitation with normal saline. D. Administer corticosteroids as prescribed. Answer: C. Initiate fluid resuscitation with normal saline. Rationale: early fluid resuscitation is crucial in sepsis to restore circulating volume and improve perfusion to vital organs. Question 14. A nurse is caring for a post-operative patient who has developed sudden chest pain, tachycardia, and hypotension. The nurse suspects a pulmonary embolism. What is the priority action? A. Administer thrombolytics as prescribed. B. Call a rapid response team and prepare for intubation. C. Administer anticoagulants immediately. D. Administer high-flow oxygen and notify the physician. Answer: D. Administer high-flow oxygen and notify the physician. Rationale: administering oxygen is the first priority to improve oxygenation in suspected pulmonary embolism, followed by notifying the physician. Question 15. A nurse is caring for a patient with a history of chronic kidney disease, CKD, who has developed hyperkalemia, K plus 6.5 milliequivalent per liter. What is the nurse's first priority action? A. Administer sodium bicarbonate to shift potassium into cells. B. Administer calcium gluconate to stabilize the myocardium. C. Prepare the patient for hemodialysis. D. Administer potassium-binding agents as prescribed. Answer: B. Administer calcium gluconate to stabilize the myocardium. Rationale: in severe hyperkalemia, calcium gluconate stabilizes the myocardium and reduces the risk of arrhythmias, which can occur at high potassium levels. Question 16. A nurse is caring for a patient who is receiving IV fluids for dehydration. The patient develops crackles in the lungs and shortness of breath. What is the nurse's first priority? A. Increase the IV rate to improve circulation. B. Administer a diuretic as prescribed. C. Assess the patient's oxygen saturation. D. Decrease the IV rate and notify the physician. Answer: D. Decrease the IV rate and notify the physician. Rationale: crackles and shortness of breath suggest fluid overload, so the IV rate should be decreased, and the physician should be notified. Question 17. A nurse is caring for a patient post-op following a thoracotomy. The patient develops sudden chest pain, tachycardia, and hypotension. What should the nurse suspect? A. Pneumothorax. B. Pulmonary embolism. C. Hemothorax. D. Myocardial infarction. Answer: B. Pulmonary embolism. Rationale: sudden chest pain, tachycardia, and hypotension in a post-op thoracotomy patient are signs of a pulmonary embolism, a life-threatening complication. Question 18. A nurse is caring for a patient with chronic respiratory failure who is receiving non-invasive positive pressure ventilation. The patient's blood gas shows pH 7.30, PaCO 260, HCO 328. What is the nurse's priority intervention? A. Increase the oxygen flow rate. B. Administer bicarbonate to correct acidosis. C. Assess the patient's respiratory effort and consider intubation. D. Encourage the patient to cough and deep breathe. Answer: C. Assess the patient's respiratory effort and consider intubation. Rationale: a pH of 7.30 with elevated CO2 suggests respiratory acidosis, and the nurse should assess the patient's ventilation and possibly prepare for intubation. Question 19. A nurse is caring for a patient who is receiving chemotherapy and develops fever, chills, and a low white blood cell count. What is the nurse's priority action? A. Administer prescribed antibiotics. B. Assess for signs of sepsis. C. Increase the patient's fluid intake. D. Notify the physician immediately. Answer. A. Administer prescribed antibiotics. Rationale. In neutropenic patients, any fever is a medical emergency, and broad-spectrum antibiotics should be started promptly after blood cultures are obtained. Question 20. A nurse is caring for a patient who has received a blood transfusion and is now experiencing chills, fever, and back pain. What is the nurse's first priority? A. Stop the transfusion and infuse saline. B. Administer antipyretics as prescribed. C. Assess the patient's vital signs. D. Call for blood bank support and notify the physician. Answer. A. Stop the transfusion and infuse saline. Rationale. These symptoms suggest a transfusion reaction. The nurse should stop the transfusion immediately to prevent further complications. Question 21. A nurse is caring for a patient who is receiving heparin therapy for a deep vein thrombosis, DVT. The patient's APTT is 85 seconds, normal range 25 to 35 seconds. What should the nurse do? A. Decrease the heparin infusion rate. B. Administer protamine sulfate. C. Increase the heparin infusion rate. D. Continue the heparin as prescribed. Answer. A. Decrease the heparin infusion rate. Rationale. An APTT of 85 seconds is elevated, suggesting the patient is at risk for bleeding. The nurse should decrease the heparin rate to bring the APTT into the therapeutic range. Question 22. A nurse is caring for a patient post-surgery who develops a sudden decrease in urine output, increased heart rate, and low blood pressure. What is the nurse's first priority action? A. Increase the IV fluid rate. B. Assess for signs of internal bleeding. C. Administer a diuretic as prescribed. D. Contact the surgeon for immediate intervention. Answer. B. Assess for signs of internal bleeding. Rationale. Decreased urine output, tachycardia, and hypotension after surgery may indicate internal bleeding, requiring immediate assessment and intervention. Question 23. A nurse is caring for a patient receiving warfarin therapy. The patient's INR is 7.0, therapeutic range 2 to 3. What should the nurse do first? A. Administer vitamin K to reverse the effects. B. Withhold the warfarin and monitor the patient. C. Increase the dose of warfarin to adjust. D. Start an anticoagulant agent to replace warfarin. Answer. A. Administer vitamin K to reverse the effects. Rationale. An INR of 7.0 is dangerously high, placing the patient at risk for bleeding. Vitamin K is needed to reverse the anticoagulation effects of warfarin. Question 24. A nurse is caring for a patient who is experiencing signs of hypoglycemia, tremors, sweating, confusion. The patient's blood glucose is 50 milligrams per deciliter. What should the nurse do first? A. Administer 50 milliliters of 50% dextrose, IV. B. Administer 15 grams of fast-acting carbohydrate orally. C. Administer insulin to decrease glucose levels. D. Increase the patient's fluid intake. Answer. B. Administer 15 grams of fast-acting carbohydrate orally. Rationale. The immediate intervention for hypoglycemia is to provide a fast-acting carbohydrate to raise the blood sugar level. Question 25. A nurse is caring for a patient with chronic obstructive pulmonary disease, COPD, who is receiving supplemental oxygen. The patient's SpO2 drops to 85%. What should the nurse do first? A. Increase the oxygen flow rate. B. Administer a bronchodilator. C. Assess the patient's respiratory rate and effort. D. Perform a peak flow measurement. Answer. C. Assess the patient's respiratory rate and effort. Rationale. The nurse should first assess the patient's breathing and respiratory status to determine the cause of oxygen desaturation before adjusting oxygen therapy. Question 26. A nurse is caring for a patient with a history of hypertension who develops sudden chest pain radiating to the left arm. What is the nurse's first priority action? A. Administer nitroglycerin as prescribed. B. Administer morphine for pain relief. C. Administer oxygen therapy and notify the physician. D. Perform an ECG to assess for a myocardial infarction. Answer. C. Administer oxygen therapy and notify the physician. Rationale. Oxygen is critical to relieve myocardial ischemia, and immediate notification to the physician is necessary for further evaluation and intervention. Question 27. A nurse is caring for a patient who is post-surgery and has a Foley catheter in place. The nurse observes a sudden decrease in urine output. What is the nurse's first action? A. Increase the IV fluid rate. B. Check for catheter patency. C. Notify the physician immediately. D. Reassess the patient's vital signs. Answer. B. Check for catheter patency. Rationale. A decrease in urine output may be due to obstruction or kinking of the catheter. Ensuring the catheter is patent is the first action to take. Question 28. A nurse is caring for a patient with a suspected stroke. The patient exhibits right-sided weakness and slurred speech. What is the nurse's first priority action? A. Administer thrombolytics as prescribed. B. Call a stroke code and prepare for a CT scan. C. Monitor the patient's blood pressure. D. Assess the patient's blood glucose level. Answer. B. Call a stroke code and prepare for a CT scan. Rationale. A suspected stroke requires immediate intervention, including a stroke code activation and preparation for a CT scan to identify the type of stroke and determine treatment. Question 29. A nurse is caring for a patient with a recent diagnosis of diabetic ketoacidosis, DKA. The patient's blood glucose is 450 milligrams per deciliter, and their pH is 7.2. What is the nurse's priority intervention? A. Administer IV insulin as prescribed. B. Administer potassium as prescribed. C. Start an IV infusion of normal saline. D. Monitor the patient's cardiac rhythm. Answer. A. Administer IV insulin as prescribed. Rationale. Insulin is the key treatment for DKA to decrease blood glucose levels and correct metabolic acidosis. Question 30. A nurse is caring for a patient who is experiencing an allergic reaction. The patient develops wheezing, swelling of the tongue, and difficulty breathing. What is the nurse's first priority action? A. Administer antihistamines as prescribed. B. Administer epinephrine as prescribed. C. Administer oxygen therapy. D. Assess the patient's blood pressure. Answer. B. Administer epinephrine as prescribed. Rationale. Epinephrine is the first-line treatment for anaphylaxis, as it quickly reverses the life-threatening symptoms of airway constriction and hypotension. Question 31. A nurse is caring for a patient who is post-operative following a hip replacement. The patient develops sudden severe pain in the affected leg, along with swelling and a decreased pulse in the foot. What is the most likely cause? A. Acute arterial occlusion. B. Deep vein thrombosis. C. Pulmonary embolism. D. Hip dislocation. Answer: A. Acute arterial occlusion. Rationale: sudden severe pain, swelling, and a decreased pulse in the foot suggest acute arterial occlusion, which requires immediate intervention. Question 32. A nurse is caring for a patient with a history of chronic hypertension who develops sudden, severe headache, nausea, and blurred vision. What is the most likely cause? A. Intracranial hemorrhage. B. Hypertensive crisis. C. Meningitis. D. Acute stroke. Answer: B. Hypertensive crisis. Rationale: sudden onset of headache, nausea, and blurred vision in a hypertensive patient suggests a hypertensive crisis, which requires immediate treatment to lower blood pressure. Question 33. A nurse is caring for a patient with a history of chronic obstructive pulmonary disease, COPD, who is receiving oxygen therapy. The patient's oxygen saturation is 90%. What is the nurse's first action? A. Increase the oxygen flow rate. B. Assess the patient's respiratory rate and effort. C. Administer a bronchodilator. D. Notify the physician immediately. Answer: B. Assess the patient's respiratory rate and effort. Rationale: the nurse should first assess the patient's respiratory status to determine the cause of low oxygen saturation before making any adjustments. Question 34. A nurse is caring for a post-operative patient who has developed sudden shortness of breath, chest pain, and a drop in oxygen saturation. What should the nurse suspect? A. Pulmonary embolism. B. Pneumothorax. C. Acute myocardial infarction. D. Atelectasis. Answer: A. Pulmonary embolism. Rationale: sudden shortness of breath, chest pain, and a drop in oxygen saturation are signs of a pulmonary embolism, a life-threatening condition that requires immediate intervention. Question 35. A nurse is caring for a patient who has developed sudden confusion and slurred speech after receiving a dose of warfarin. What is the nurse's first priority action? A. Administer vitamin K as prescribed. B. Increase the IV flow rate. C. Assess the patient's neurological status. D. Check the patient's INR and notify the physician. Answer: D. Check the patient's INR and notify the physician. Rationale: sudden confusion and slurred speech in a patient receiving warfarin suggest a potential bleeding complication, so the nurse should check the INR and notify the physician immediately. Question 36. A nurse is caring for a patient with diabetes who is receiving insulin. The patient is exhibiting signs of hypoglycemia, including sweating, tremors, and confusion. What should the nurse do first? A. Administer 50% dextrose, IV. B. Administer 15 grams of glucose orally. C. Administer insulin to lower glucose levels. D. Monitor the patient's blood glucose every 30 minutes. Answer: B. Administer 15 grams of glucose orally. Rationale: the immediate intervention for hypoglycemia is to provide a fast-acting carbohydrate, such as 15 grams of glucose, to raise blood sugar levels. Question 37. A nurse is caring for a patient who is post-operative following a hip replacement. The patient's leg is externally rotated, and they are experiencing severe pain. What should the nurse suspect? A. Hip dislocation. B. Deep vein thrombosis, DVT. C. Hemorrhage at the surgical site. D. Nerve damage. Answer: A. hip dislocation. Rationale: external rotation and severe pain in a post-operative hip replacement patient are signs of hip dislocation, which requires immediate intervention. Question 38. A nurse is caring for a patient with a history of stroke. The patient begins to exhibit weakness on one side of the body and slurred speech. What is the nurse's first priority action? A. Administer clot-busting drugs. B. Assess the patient's blood pressure. C. Call a stroke code and prepare for a CT scan. D. Position the patient in high Fowler's position. Answer: C. Call a stroke code and prepare for a CT scan. Rationale: a suspected stroke requires immediate intervention, including calling a stroke code and preparing for imaging to determine the appropriate treatment. Question 39. A nurse is caring for a patient who is receiving total parenteral nutrition, TPN. The nurse notes that the TPN bag has expired. What is the nurse's first priority? A. Administer dextrose IV until a new TPN bag is available. B. Change the TPN bag immediately and monitor the patient. C. Increase the patient's oral intake to meet nutritional needs. D. Notify the physician for further guidance. Answer: A. Administer dextrose IV until a new TPN bag is available. Rationale: if the TPN bag has expired, the nurse should administer dextrose IV to prevent hypoglycemia while waiting for a new TPN bag to be available. Question 40. A nurse is caring for a patient who has recently undergone a lumbar puncture. The patient develops a headache, nausea, and vomiting. What is the most likely cause of these symptoms? A. Infection from the puncture. B. Post-lumbar puncture headache due to CSF leak. C. Increased intracranial pressure. D. Atypical migraine headache. Answer: B. Post-lumbar puncture headache due to CSF leak. Rationale: a headache after a lumbar puncture is commonly caused by a cerebrospinal fluid (CSF) leak, which can be treated with a blood patch. Question 41. A nurse is caring for a patient with congestive heart failure (CHF), who develops sudden shortness of breath, orthopnea, and pink frothy sputum. What should the nurse suspect? A. Pulmonary edema. B. Acute myocardial infarction. C. Pneumothorax. D. Chronic obstructive pulmonary disease, COPD, exacerbation. Answer: A. Pulmonary edema. Rationale: sudden shortness of breath, orthopnea, and pink frothy sputum are hallmark signs of pulmonary edema, a life-threatening complication of heart failure. Question 42. A nurse is caring for a patient with a history of stroke who is now experiencing dysphagia. What is the nurse's first priority? A. Perform a swallowing assessment and implement appropriate interventions. B. Administer thickened liquids as prescribed. C. Position the patient in high Fowler's position during meals. D. Offer the patient a soft diet to prevent aspiration. Answer: A. Perform a swallowing assessment and implement appropriate interventions. Rationale: dysphagia after a stroke can lead to aspiration, so a swallowing assessment is needed to implement the safest feeding strategies and prevent aspiration. Question 43. A nurse is caring for a patient who is receiving intravenous IV fluids. The nurse notices that the IV site is cool, swollen, and painful. What should the nurse suspect? A. IV infiltration. B. IV phlebitis. C. IV infection. D. Fluid overload. Answer: A. IV infiltration. Rationale: coolness, swelling, and pain at the IV site indicate infiltration, where the IV fluid has leaked into the surrounding tissue. The IV should be discontinued, and the site should be assessed further. Question 44. A nurse is caring for a post-operative patient who has developed a hematoma at the surgical site. The patient's blood pressure is stable, but the nurse notices the patient is increasingly restless and complaining of pain. What is the nurse's priority intervention? A. Apply ice to the surgical site to reduce swelling. B. Administer pain medication as prescribed. C. Assess the surgical site for increased bleeding. D. Monitor the patient's vital signs and oxygen levels. Answer. C. Assess the surgical site for increased bleeding. Rationale. Restlessness and pain after surgery may indicate ongoing bleeding. The nurse should assess the surgical site for signs of excessive bleeding or hematoma expansion. Question 45. A nurse is caring for a patient who has recently undergone a cesarean section and is experiencing decreased urine output and rising creatinine levels. What is the nurse's priority action? A. Administer fluids as prescribed. B. Monitor the patient's blood pressure. C. Assess for signs of urinary retention. D. Notify the physician for possible renal impairment. Answer. A. Administer fluids as prescribed. Rationale. Decreased urine output and rising creatinine may suggest renal impairment or dehydration. Administering fluids is essential to improve renal function and output. Question 46. A nurse is caring for a patient who has been diagnosed with an acute myocardial infarction, MI. The patient is receiving nitroglycerin and their blood pressure drops significantly. What should the nurse do first? A. Discontinue the nitroglycerin infusion. B. Administer morphine as prescribed. C. Increase the IV fluid rate. D. Administer a vasopressor as prescribed. Answer. A. Discontinue the nitroglycerin infusion. Rationale. Nitroglycerin can cause hypotension, and if the patient's blood pressure drops significantly, the nurse should stop the infusion to prevent further complications. Question 47. A nurse is caring for a patient with a history of asthma. The patient suddenly develops wheezing, cough, and difficulty breathing. What should the nurse do first? A. Administer a bronchodilator as prescribed. B. Administer an intravenous corticosteroid. C. Perform a respiratory assessment. D. Encourage the patient to use pursed lip breathing. Answer. A. Administer a bronchodilator as prescribed. Rationale. A bronchodilator is the first-line treatment for acute asthma exacerbations to relieve bronchospasm and improve airflow. Question 48. A nurse is caring for a post-operative patient who develops confusion, agitation, and hyperreflexia. The patient has a history of serotonin syndrome. What is the priority intervention? A. Administer an SSRI as prescribed. B. Discontinue the serotonin receptor agonist immediately. C. Administer a benzodiazepine to reduce agitation. D. Start an antipsychotic medication. Answer. B. Discontinue the serotonin receptor agonist immediately. Rationale. Serotonin syndrome is caused by excessive serotonergic activity, and the first intervention is to stop the medication responsible for it. Question 49. A nurse is caring for a patient with severe burns covering 40% of their body. What is the nurse's first priority in the initial phase of burn treatment? A. Administer intravenous fluids for resuscitation. B. Administer pain medications as prescribed. C. Perform wound debridement. D. Apply topical antibiotics to the burns. Answer. A. Administer intravenous fluids for resuscitation. Rationale. The priority in the first 24 to 48 hours following severe burns is fluid resuscitation to prevent shock and maintain adequate perfusion. Question 50. A nurse is caring for a patient with a new diagnosis of diabetes. The patient's blood glucose is 350 milligrams per deciliter. What is the nurse's first priority intervention? A. Administer insulin as prescribed. B. Encourage the patient to increase fluid intake. C. Educate the patient about lifestyle changes. D. Monitor the patient's potassium level. Answer. A. Administer insulin as prescribed. Rationale. The first priority in managing hyperglycemia is administering insulin to reduce the blood glucose to a safe level. Question 51. A nurse is caring for a post-operative patient who is at risk for deep vein thrombosis, DVT. What is the most effective intervention to prevent DVT in this patient? A. Apply compression stockings. B. Encourage ambulation and leg exercises. C. Administer anticoagulants as prescribed. D. Perform passive range of motion, ROM exercises. Answer. B. Encourage ambulation and leg exercises. Rationale. Early ambulation and leg exercises are highly effective in preventing DVT post-operatively. Question 52. A nurse is caring for a patient with a suspected cerebrovascular accident, CVA. The nurse observes that the patient is unable to speak and has right-sided weakness. What is the first priority action? A. Administer a thrombolytic agent. B. Assess the patient's vital signs. C. Call a stroke code and prepare for imaging. D. Perform a swallowing assessment. Answer. C. Call a stroke code and prepare for imaging. Rationale. A suspected stroke requires immediate action to administer thrombolytics and determine the type of stroke through imaging. Question 53. A nurse is caring for a patient with a history of alcohol abuse. The patient is exhibiting tremors, agitation, and confusion 48 hours after admission. What is the nurse's priority intervention? A. Administer lorazepam as prescribed. B. Administer intravenous fluids. C. Administer potassium supplements. D. Perform a full neurological assessment. Answer. A. Administer lorazepam as prescribed. Rationale. Alcohol withdrawal can cause these symptoms, and lorazepam is used to prevent complications like seizures and delirium tremens. Question 54. A nurse is caring for a patient with acute kidney injury, AKI, who is receiving diuretics. The nurse observes a decrease in the patient's urine output. What is the nurse's priority action? A. Increase the diuretic dosage. B. Notify the physician of the decreased urine output. C. Assess the patient for signs of dehydration. D. Administer potassium as prescribed. Answer. C. Assess the patient for signs of dehydration. Rationale. Decreased urine output despite diuretics may indicate dehydration or worsening kidney function, requiring further assessment. Question 55. A nurse is caring for a post-operative patient who suddenly develops a fever, chills, and elevated white blood cell count. What is the nurse's first priority? A. Administer prescribed antibiotics. B. Assess the surgical site for signs of infection. C. Administer antipyretics to reduce fever. D. Notify the physician of the symptoms. Answer. B. Assess the surgical site for signs of infection. Rationale. The nurse should assess the surgical site for signs of infection, which may be the cause of the fever and elevated WBC count. Question 56. A nurse is caring for a patient who has been diagnosed with pulmonary embolism, PE. The patient develops sudden shortness of breath, chest pain, and confusion. What is the nurse's first priority? A. Administer oxygen therapy. B. Administer anticoagulants. C. Perform a chest X-ray. D. Prepare for intubation. Answer. A. Administer oxygen therapy. Rationale. Oxygen therapy is the first priority to support oxygenation and prevent hypoxia in a patient with PE. Question 57. A nurse is caring for a patient receiving IV morphine for pain management. The patient's respiratory rate drops to 6 breaths per minute. What is the nurse's first priority? A. Administer naloxone as prescribed. B. Increase the IV morphine dosage. C. Administer oxygen therapy. D. Monitor the patient's blood pressure. Answer. A. Administer naloxone as prescribed. Rationale. Naloxone is the antidote for opioid overdose and should be administered immediately to reverse respiratory depression. Question 58. A nurse is caring for a patient with severe respiratory distress and a history of asthma. The patient's oxygen saturation is 88%, and they are unable to speak in full sentences. What should the nurse do first? A. Administer a bronchodilator. B. Administer a corticosteroid. C. Provide high-flow oxygen. D. Prepare the patient for intubation. Answer. A. Administer a bronchodilator. Rationale. Administering a bronchodilator is the first-line treatment for acute asthma exacerbations to relieve bronchospasm. Question 59. A nurse is caring for a post-operative patient who develops sudden, severe chest pain, hypotension, and tachycardia. What should the nurse suspect? A. Pulmonary embolism. B. Myocardial infarction. C. Hemorrhage at the surgical site. D. Pneumothorax. Answer. A. Pulmonary embolism. Rationale. Sudden chest pain, hypotension, and tachycardia in a post-operative patient suggest a pulmonary embolism, which is a life-threatening complication. Question 60. A nurse is caring for a patient who is post-operative following a total knee replacement. The patient reports sudden sharp pain in the calf, and the calf is red and swollen. What is the nurse's priority action? A. Administer a pain reliever as prescribed. B. Perform a Doppler ultrasound to assess for DVT. C. Elevate the leg and apply a warm compress. D. Apply compression stockings as prescribed. Answer. B. Perform a Doppler ultrasound to assess for DVT. Rationale. The symptoms of pain, redness, and swelling in the calf suggest deep vein thrombosis, DVT, which requires immediate diagnostic assessment. Question 61. A nurse is caring for a patient with acute pancreatitis. The patient has a temperature of 101 degrees Fahrenheit and is complaining of severe abdominal pain. What is the nurse's first priority? A. Administer prescribed antibiotics. B. Administer pain medications as prescribed. C. Administer IV fluids for hydration. D. Assess the patient's serum amylase and lipase levels. Answer. C. Administer IV fluids for hydration. Rationale. Fluid resuscitation is critical in acute pancreatitis to manage hypovolemia and prevent shock. Question 62. A nurse is caring for a post-operative patient with a Foley catheter. The nurse observes that the urine output has decreased to 20 milliliters per hour. What is the nurse's first priority? A. Increase the IV fluid rate. B. Assess the catheter for kinks or obstruction. C. Administer a diuretic as prescribed. D. Notify the physician of the low output. Answer. B. Assess the catheter for kinks or obstruction. Rationale. Decreased urine output may be due to obstruction or kinking of the catheter, and it should be assessed before other interventions are made. Question 63. A nurse is caring for a patient who is post-operative following a mastectomy. The patient reports tingling and numbness in the affected arm. What is the nurse's first priority? A. Assess the patient for signs of infection at the surgical site. B. Assess the patient for signs of lymphedema. C. Administer pain medications as prescribed. D. Encourage the patient to perform arm exercises. Answer. B. Assess the patient for signs of lymphedema. Rationale. Tingling and numbness after mastectomy can indicate lymphedema, which requires early detection and management to prevent further complications. Question 64. A nurse is caring for a patient who is receiving chemotherapy. The patient develops a temperature of 101.5 degrees Fahrenheit and reports chills. What should the nurse do first? A. Administer acetaminophen as prescribed. B. Obtain a blood culture before starting antibiotics. C. Administer antibiotics as prescribed. D. Assess the patient's white blood cell count. Answer. B. Obtain a blood culture before starting antibiotics. Rationale. In immunocompromised patients, such as those receiving chemotherapy, blood cultures should be obtained before administering antibiotics to identify the infecting organism. Question 65. A nurse is caring for a patient who is receiving total parenteral nutrition, TPN. The nurse notes that the TPN bag has expired and is no longer available. What should the nurse do first? A. Administer 10% dextrose IV until the new TPN bag arrives. B. Increase the patient's oral intake to compensate for the nutrition. C. Notify the physician immediately and prepare to discontinue TPN. D. Monitor the patient's blood glucose and adjust as necessary. Answer. A. Administer 10% dextrose IV until the new TPN bag arrives. Rationale. To prevent hypoglycemia in a patient receiving TPN, a 10% dextrose solution should be administered until a new TPN bag is available. Question 66. A nurse is caring for a patient with a history of heart failure who is experiencing sudden shortness of breath, crackles in the lungs, and edema. What is the nurse's priority action? A. Administer IV furosemide as prescribed. B. Administer oxygen therapy. C. Perform a complete cardiovascular assessment. D. Increase the patient's fluid intake. Answer. A. Administer IV furosemide as prescribed. Rationale. IV diuretics are used to reduce fluid overload in patients with heart failure, alleviating symptoms like shortness of breath and edema. Question 67. A nurse is caring for a patient with a suspected stroke. The patient is alert and oriented, but has a noticeable facial droop on the right side. What is the nurse's priority intervention? A. Administer aspirin to reduce clot formation. B. Prepare the patient for a CT scan to confirm the stroke type. C. Administer thrombolytic therapy as prescribed. D. Position the patient in high Fowler's position. Answer. B. Prepare the patient for a CT scan to confirm the stroke type. Rationale. Rapid diagnosis of the type of stroke is essential to determine the appropriate treatment, for example thrombolytics, for ischemic stroke. Question 68. A nurse is caring for a post-operative patient who suddenly becomes pale, diaphoretic, and hypotensive. What is the nurse's priority action? A. Administer IV fluids to improve circulation. B. Perform a quick neurological assessment. C. Assess the surgical site for signs of bleeding. D. Increase the oxygen flow rate. Answer. C. Assess the surgical site for signs of bleeding. Rationale. Sudden hypotension, pallor, and diaphoresis suggest internal bleeding, especially post-operatively, requiring immediate assessment of the surgical site. Question 69. A nurse is caring for a patient with sepsis. The patient's blood pressure is 80/50 millimeters of mercury, and their heart rate is 130 BPM. What is the nurse's first priority intervention? A. Administer broad-spectrum antibiotics. B. Administer IV fluids to restore circulating volume. C. Prepare the patient for mechanical ventilation. D. Administer vasopressors as prescribed. Answer. B. Administer IV fluids to restore circulating volume. Rationale. In sepsis, fluid resuscitation is the first priority to improve tissue perfusion and prevent organ failure. Question 70. A nurse is caring for a patient with a history of chronic obstructive pulmonary disease, COPD. The patient is now experiencing increased wheezing, dyspnea, and decreased oxygen saturation. What is the nurse's first priority? A. Administer a bronchodilator. B. Increase the oxygen flow rate. C. Administer corticosteroids as prescribed. D. Reposition the patient to improve breathing. Answer. A. Administer a bronchodilator. Rationale. Bronchodilators are the first-line treatment to relieve bronchospasm and improve airflow in patients with COPD exacerbations. Question 71. A nurse is caring for a patient with suspected meningitis. The patient has a positive Koenig sign and is exhibiting nuchal rigidity. What is the nurse's priority action? A. Administer prescribed antibiotics. B. Perform a lumbar puncture to confirm the diagnosis. C. Administer pain medication as prescribed. D. Monitor the patient for signs of seizures. Answer. B. Perform a lumbar puncture to confirm the diagnosis. Rationale. A lumbar puncture is necessary to obtain cerebrospinal fluid for analysis to confirm meningitis. Question 72. A nurse is caring for a patient post-surgery who is experiencing signs of shock, including tachycardia, hypotension, and weak pulses. What is the nurse's first priority intervention? A. Administer oxygen therapy and elevate the legs. B. Administer IV fluids to restore volume. C. Prepare for surgery to repair the surgical site. D. Assess for signs of infection and notify the physician. Answer. B. Administer IV fluids to restore volume. Rationale. Shock often results from fluid loss or blood loss, and IV fluids are essential to restore circulating volume and improve perfusion. Question 73. A nurse is caring for a patient who is post-operative following a thyroidectomy. The patient begins to exhibit muscle spasms, tingling in the lips and fingers, and a positive Chvostek sign. What is the nurse's priority intervention? A. Administer calcium gluconate as prescribed. B. Administer an antiemetic as prescribed. C. Reposition the patient to relieve neck tension. D. Increase the patient's oral intake of calcium-rich foods. Answer. A. Administer calcium gluconate as prescribed. Rationale. These signs and symptoms suggest hypocalcemia, which can occur after thyroidectomy due to damage to the parathyroid glands. Question 74. A nurse is caring for a post-operative patient who has developed a deep vein thrombosis, DVT. What is the priority nursing intervention to prevent complications? A. Administer anticoagulants as prescribed. B. Apply compression stockings to both legs. C. Elevate the legs to improve venous return. D. Encourage early ambulation and leg exercises. Answer: D. Encourage early ambulation and leg exercises. Rationale: early ambulation and leg exercises help prevent the development of DVT post-surgery. Question 75. A nurse is caring for a patient who has been diagnosed with acute pancreatitis. The patient's pain is not relieved by the prescribed pain medications. What is the nurse's priority action? A. Increase the pain medication dosage. B. Assess the patient's abdominal assessment findings. C. Notify the physician for further pain management orders. D. Administer an antiemetic to prevent nausea. Answer: B. Assess the patient's abdominal assessment findings. Rationale: unrelieved pain in acute pancreatitis may indicate worsening symptoms or complications, requiring a thorough abdominal assessment. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.